Thank you very much for taking the time to be here today. So we're going to be talking about mental health. As Kashila mentioned, you can leave your mics on muted, but be ready to be on a video, because at some point maybe we can have a group picture, and it's always more interesting to see you. So I think we'll just launch into it. These couple of weeks or month, I should say, have been really amazing in terms of the communication around mental health. And I'm very grateful for organizations like edVentr and so many others that are working very hard towards bringing awareness to mental health. So what exactly is mental health? All of you must have heard about mental health at some point in these recent times. We hear more about mental health because our lives as we know it has changed significantly. People talk about stress, people talk about depression, but most importantly, you hear the term mental health very often. So I want you to use the chat. Tell me your name, tell me what do you do, and tell me what is mental health for you. Or you could also put in, any of your expectations. What is it that you hope to take away from today? So feel free to use the chat. It's a good way to get to know each other, and maybe the 1 hour is quite short to cover everything on mental health. But if you have something specific, we might cover them in the questions. So let's start with a very brief presentation. What exactly is mental health? I can't see any chats yet. Okay. Hi, Geeta. What is mental health for you? Mrs. Gura, hi. Good to see you again. So I see a lot of familiar people from UTM. Very happy to see you all. So what is mental health? What do you think it's important? Okay, so we'll give you time to answer. No pressure there. What are we going to do today? We're going to cover, first of all, what is mental health? It's very important to understand the term as we use it. Sometimes as professionals use it, but at the same time, something which is so relevant to all of us. It's very important as well to understand the distinction between mental health and mental illness. Very often, unfortunately, in our culture, in our society, whenever we hear the term mental, people are not comfortable at all. So there are lots of instances where you would see people, looking at mental health exactly like they would look at mental illness, with a lot of somewhere a lot of embarrassment, this feeling of not wanting to come out openly and talking about it, the feeling of being judged, etc. So we're not going to go too much into the details, but we are definitely going to cover the main differences between mental health and mental illness. I want to talk about mental health professionals as well, which I believe is extremely important, especially more in the context of mental health illness than mental health itself. And of course, we're going to finish with a few tips, and then we're going to take your questions. So what is mental health generally? The World Health Organization defines mental health as a state of well-being. It is quite, it is quite broad as a term, and it encompasses many things. It's not just one aspect that we consider mental health. These are aspects which are physical. These are aspects which are social. These are aspects which can also be spiritual, financial, etc. So it's a whole combination of many factors that are part and parcel of well-being that will constitute anybody's mental health. So basically, what do we mean by having a good mental health is when an individual is in a position where they realize their own potential, they're very happy with where they are, with what they're doing. They can cope with the normal stresses of life. And this also can be a little tricky. We hear the term stress very often in this whole area of mental health. Stress is not entirely a bad thing. Stress is not something which is very much dangerous and very much out of a context. All of us have the capacity to deal with our everyday stress levels. So it could be something related to work. It could be something related to our personal environment, related to family, related to anything that we're doing. And we all can deal usually with that stress. We might not feel, really on top of our form a day, but we can deal with it and with time get better at handling particular types of stress. Now, when that stress is too much in terms of intensity or sometimes in terms of duration, then it is another story. Then you can develop what we call chronic stress, or some forms of stress that are not related to normal circumstances. For example, you were in an accident where you felt that you could have lost your life, or you saw somebody pass away with COVID, and now you have it and you are worried about yourself. So all these situations are not really what we would consider normal, and it might be more difficult for you to deal with these stresses than what you could face in your everyday life. We talk about a good mental health when a person can work productively and fruitfully, and they are able to make their own contribution in their communities and societies and wherever you are. So very often we tend to hear the term illnesses, diseases, mental health problems, and they were all quite common terms, but there is a distinction. So before we move on to what exactly is mental health illness, it's very important to understand that just like health, right? So when we talk about health, a person who's healthy is not just the person who does not have any illness. I can not have any disease, any illnesses, but I do not feel particularly healthy. So if you look at the diagram here, you'll see that people can have extraordinary, very good mental health without having any illness. People can have a very poor mental health and yet not have any illnesses. And at the same time, people can have good mental health with mental illness that is, of course, that is taken care of, and that is in a way managed with proper, care in a structured setup in most of the times. So it depends, and also what I would want to, remind you again and again is one of the reasons why psychology exists also is because no two people are exactly the same. So when we talk about, you don't have a mental illness, but you have good mental health, or this is a tip that you can do, etc. They are general guidelines which should work for you, but it's not necessarily true in all the different cases. So always remember that, individuals are different, and, you can find yourself anywhere in this continuum with or without something that we are going to call a mental illness. And it's absolutely okay. It doesn't mean that it is a fixed state of being. It does not mean that you cannot move to a better position on the continuum. And this is what we're aiming to do today. Today, we're looking at how can we, in our daily life, with everything that's been thrown on our path, how can we, in a way, have a better mental health? How can we aim at working towards some of the small things that we can do, some of the bigger things that we can do, just to feel, better generally. So I love this diagram for some reason, because there are so many myths and so many ideas that somehow we have around mental health that just isn't true. Mental health most definitely is important, and it is not a sign of weakness. No matter what you've been told before, mental health issues, mental health which is not to an optimum level, is something that each and every one of us are going to go through at some point of their lives. It is not a sign of weakness. In most situations, these are moments that you're going to handle, that you're going to go beyond and feel better. But sometimes it does happen that you feel that you need professional help, and you feel like you cannot control some your actions or things that are happening to you, or how you feel based on the things that are happening to you. And it's absolutely okay to seek professional help as well. So it's something that everybody is intrinsically linked to. So mental health is not something which only concerns the younger generation. It's not something that only concerns the elderly. It's not something that concerns only an educated population, for example. It is everybody's concern. And then there may be sometimes we don't call it mental health, but it is something that is meaningful to everybody. It's worth making time for mental health. It's worth making time out to work on your mental health. Try to improve it every day with whatever you think can work for you. And it's a very complex idea, like we spoke about initially. That it's very difficult to give you like a definition that is very much clear cut of mental health, because it is so many things at the same time. And it is definitely a combination of all of these little things that are going to create a sense of well-being, that you cannot, for example, you cannot have one and not have the other. So we can, for example, say that mental health is all about being spiritually very much advanced, but if you have financial issues, you're going to be stressed out because of those financial issues. And that is an equally important part of your mental health, for example. So it is definitely not just a sign of weakness. It is not shameful. Very often you hear people say that it's all in your head, just, smile and things are going to be okay. Or go outside, sit in the sun, and you're going to feel nice. It does help sometimes, but it's not the solution to every one of your feelings of something being wrong. It's not something that you have to think about only when there is a problem. This is another very dangerous misconception that we have about mental health. Sometimes we think about mental health as something which does not exist until there is a problem. So when there is a problem, that's when we're going to think, okay, mental health, I need to do this. I need to take some time out. I need to relax for a while, or I need to go work out, etc. So this is something that you can start building on at any point in your life, and you can definitely improve it. And mental health is not the same as mental illness. As we discussed earlier, you can have a poor mental health without having any kind of diagnosis of an illness, or you can have excellent mental health even if you have a diagnosis of a mental illness that is managed properly. It's mental health is not about feeling good all the time. Sometimes people think that if I have good mental health, I'm always going to be prancing about, happy, singing and dancing, and it's not like that. You're just a human being like everybody. You're going to have ups and downs, just like everybody, but it would not mean that you have a poor mental health. It is not something that you can just, snap out of, or, change your mindset, or stop acting this way. Sometimes people will tell you, it's all in your head, don't act depressed because then you're going to be depressed, etc. So it doesn't work like that, unfortunately. And it is it's very, very important, especially during these times, that we look at mental health, and especially kind of the low points of mental health, and realize to what extent they can be connected to what we see around us. So it's very important to limit what is going around us, because that ultimately is going to affect how we feel about so many things. So just to recap, your mental health is your general state of well-being, as we discussed. It encompasses many, many aspects of your life, and it is something that you should be looking after at all points in time, no matter your age. It doesn't matter what you are doing, it doesn't matter what kind of responsibilities you are, etc. It's very important to work on your mental health and look after it and take time out to take care of it. And mental illness is something that is going to disrupt your mental state. When we talk about mental illness, it is something which is a little bit more, in a way, technical. We talk about mental illness. We talk about, for example, some of the most common ones are depression. You could have chronic stress. You can have bipolar disorders. You can have anxiety. A lot of people suffer from anxiety. And unfortunately, when there is a COVID scare, it tends to increase in a lot of cases. People's routines are disturbed, and you have a lot of news around that are not really positive all the time. So that can be quite a handful to deal with. So a mental illness is going to interrupt how you feel, how you think, how you communicate, how you behave, and you're not going to have a lot of control over things initially with a mental illness. How do you, come to a point where you decide that there is a mental illness? Is through a diagnosis that has been carried out by a professional. Talking about professional, it's very important to understand who these people are. So one of the biggest debate, one of the everlasting feud in psychology is this whole psychiatrist versus psychologist debate, and they are quite different professions, to be honest. So psychiatrist is a specialized area of medicine. So your general practitioner can decide to specialize himself in psychiatry, and is going to still be a doctor, but will be specialized in whatever concerns mind and behavior. On the other side, your psychology, which is a completely different stream, for all the students here who are interested in probably studying psychology. So this is a very different stream of studies that you would follow. And a psychologist, of course, both of them would be, skilled and trained and entitled to make diagnoses. But the way they approach a situation is going to be very different. So psychologists believe in talk therapy, a lot of counseling sessions. For example, CBT is very popular these days, and always kind of has been, because it tends to be therapies that are planned over a shorter period of time and very much goal-oriented. So for the client and for the psychologist, almost instantly whether it is working or not, and you can see the results as a consequence. So you have different if you want, streams in psychology as well. So different psychologists have different schools of thoughts that they adhere to, and that can influence a little bit the kind of therapy that they do. But generally, most of it is talk therapy. Your psychologist is not, for example, allowed to prescribe you medication. In a few states in the United States, a psychologist would be allowed to prescribe, but those are also very limited. But over the world, generally, a psychologist is not allowed to prescribe any kind of medication, whereas your psychiatrist is. And these very often, especially in developed countries, are going to work as a team. So your psychiatrist and your psychologist can both be therapists if they have been trained in psychotherapy. It's not always the case. It's not always the intention and the inclination as well. And not everybody likes doing that. But if they are trained, they could be psychotherapists as well. And you have so many other professionals. You have a lot of counselors, excellent ones in Mauritius as well. You have counselors that specialize in specific fields. You have clinical social workers. You have psychiatric nurses, etc. Not a lot of them as specialized professionals exist and work in Mauritius, but in other places of the world, people in for example, social workers and nurses would get very specific training to work with psychological psychiatric problems. So I think we're good with this. Now let's look at the most favorite part of most of these mental health talks that I do. People are always very interested to know, what can we do? How can we improve? So this is very basic. There might be something that you do for yourself that is not there. And if it works for you, stick to it. But as a general rule, you cannot really have a healthy mind in a body that is not healthy. Now, of course, you're going to have diseases, illnesses that you cannot control, and there's nothing we can do about them. But even then, with proper management, you can definitely improve your mental health. For example, a lot of people, when they discover that they have diabetes, it is a very stressful moment for them, because it is something that in most cases would mean that you'd have to stick to your medication for life. So that could affect your mental health initially. But as you start managing your mental health, you will see that there's a lot of progress that you can make to feel better, to be in a better space. And that will eventually also bring it all back to the management of your disease. So if you're not stressed, you will see that you're going to have better control over it. The same thing for blood pressure, for example. So there are things that we're never going to be able to 100% control with our bodies, but we can control some of the very basic things. Are we sleeping properly? Are we eating properly? What is it that we're eating? What makes us feel good? What doesn't really make us feel good? Are we working out? I know it must be really hard with all the restrictions that are in a way back again. A lot of you probably go to the gym, work out with groups, and it's always fun. You get motivated when you look at other people, but it's very important to try to find ways to do that, even though we're currently facing a crisis, because it's really very important to exercise and to keep active. You cannot hope for a good health if you're not active. And I think most of you would have done the experiment. If you just stay indoors and not do much, after a couple of days, you really start feeling a bit edgy, not really, comfortable. So you need not, for example, when I say keep active, you don't need to go to the gym and build muscles or, have abs. It could be going for a walk. It could be, gardening, could be jumping in your room. It could be anything. So don't let yourself believe that exercise is only exercise if it looks fancy or sounds fancy. So you don't need to necessarily be doing yoga or Pilates or whatever. You could just be jumping in your room and you'd be sweating and you'd feel good about it. So very important to talk about your feelings, especially right now. A lot of people are scared. And if you look around, a lot of people do not know how to say that they're scared. It's not something that we learn. It's not something that we're very good at. We generally do not like to admit to our vulnerable, to the vulnerable part in us. And we definitely don't want to be sharing that too much. But sometimes it does a lot of good to talk about your feelings. And you'd see that by the end of it, you kind of feel relieved. So if you want to talk to a professional, by all means. But sometimes if you talk to a friend as well, you do feel that sense of relief that you can generally have. So keep active, eat well, make sure that especially right now, you're eating balanced meals, you're eating on time. Take a break. Working from home can be really hard. Sometimes you feel like, I'm going to be at home, I will be comfortable, everything is going to be great. But without really realizing it, you sometimes might be working harder when you're at home and for longer spans of time. So it's really very important to take a break. And if that break is something that gets you to be active, it's better. It's the best kind of a break. But also a break could be like, take time out, sit outside, look at the sky, take drink a cup of tea, think about how you're feeling, think about what you're doing, think about what is the one thing that you want to do today or this week, etc. So very important, especially I see a lot of young people, alcohol is a very big problem. Alcohol very often, unfortunately, becomes a way of coping, of dealing with, a poor mental health. And this is really terrible on many, many levels. So alcohol is what we call a maladaptive coping mechanism. What it means is that you feel like it is taking the pressure off you, but what it actually does is that it builds a lot more pressure to come. So alcohol by nature is a depressant. So it might make you feel like you have control over things and on top of the world temporarily, but the aftermath of it is really quite terrible. And if you have like a long-term usage that is not controlled, it's really very bad for your health. Overall, we talk about alcoholism, we talk about the usage, when you drink too much or you drink too often, it's really not good. And if you kind of like start early, what happens is you tend to be very dependent on alcohol as a way of coping and kind of miss out on developing healthy ways of coping. So always be very careful. There are many people that you can talk to if you feel like you have an issue with alcohol. There's no shame about it if you want to seek help to get out of it. So reach out, talk to professionals, talk to people around you. If you have somebody who you trust at work, in your family, talk to people. The fact that you're talking about it helps you realize that there's a problem there and that I need to work on that problem. Very important as well, keeping in touch. Not going out, breaching all the COVID protocols to meet up and gather and not be safe. But keeping in touch could also be, video calling family, calling your friends, having a group call, etc. All of us have, group calls, meetings, etc. at work, or you'll have classes if you are at UTM. But how often do you actually call all your friends and say, we're going to meet on Zoom today just to chat and chill out together? So try to do that. It's always interesting. Check in on your elderly relatives as well. It's really not easy for them. To a certain extent, the younger generation has the internet. They have access to so many devices and ways of communicating. The elderly people do not really feel that level of comfort very often with regards to technology. So it's very important to reach out to them as well. And if you kind of look at the way their lives are planned, a lot of it depends on physically being able to interact and being out there in the community. So they have it quite bad when there are restrictions like that. So it doesn't, it does not need to be long. It could be like a 10-15 minutes call just to check on the person, ask them how they feel, share a story, crack a joke. It could be anything, but keep in touch. Do something that you're good at. I loved that for the first confinement, so many people I know discovered that they could knit, that they could do embroidery, that they were good cooks, that they could be really good at gardening. So if you don't have any skills like me, you don't need to worry. Just do something that you enjoy. You do not need to be like, an excellent cook or very good at painting or something like that. It's also okay if you're not good at something. So do something that you enjoy. If you enjoy dancing or painting, for example, you're not doing it for a competition. You're doing it for yourself. So do it anyway. Accept who you are. We spend a lot of time fighting with ourselves. We want to look a certain way. We want to sound a certain way. We want to feel a certain way. At some point, it's very, very important to, of course, do whatever you can to change something that you're not happy with. But it's also important to accept that it's okay to be how you are. So, for example, if you have a problem that needs to be worked on, you would, of course, be doing your best to work on it. But at the same time, there is a time where you need to realize that not everything can be changed. So once you accept the things that you cannot change, you will find that they become easier to live with and to kind of appreciate. Ask for help if you need it, even if you're not 100% convinced that you need the help. There's no harm in talking to people. It is always better to be safe. So care for others. There's a lot of of the good emotions that all of us get when we try to do something selflessly for other people. So when you ask for help, try to offer it as well. If you feel like there's a friend, there's a family member, there's anybody who wants to talk, wants to spend time together, etc., reach out. Sometimes people might want to do it, but they might feel like, they can't do it or not very confident about it. So if you know that is true for somebody, there's no harm in reaching out first. So try to care for others as well. These are very difficult times, and it's really important that all of us, think about each other as well. As finishing words, what I would like to tell you is that always remember that you're unique and beautiful. No matter what you think, that is true for everybody. That is true for each one of you here. Also remember that you're not alone, even though sometimes it might feel like you are, but you are never alone. Sometimes it's just a matter of picking up the phone and calling someone. It's a matter of sending out that message, etc. And remember that you can do this. You might be at a point where you feel like nothing is going to change. This is going to be, a forever thing, etc. But even this shall pass. Thank you very much and stay safe, everyone.